Hi there. My name is Star Edwards. I'm a dietitian and the healthcare practice director at Tiny Health. And in this video, I'm going to discuss microbiome testing for exercisers and athletes. I'm going to start by setting the foundation with what the microbiome is, characteristics of a healthy microbiome versus an unhealthy microbiome disrupting factors that lead to an unhealthy microbiome, why it is important to test, who should test and when to test, as well as what the microbiome looks like in exercisers and athletes and how it may or may not be different to the general population, what to look for on a tiny health test, and how to use this information to help your clients. And finally, in a separate presentation, we'll be using the information I share with you here to walk through a set of your client results. What is the gut microbiome? Well, microbiome in general is a collection of microorganisms in a particular environment. It could be bacteria, archaea, fungi, viruses, and protists, for example. Here is a depiction of all the different types of microbiomes we have in and on our body. It's not just in our gut. We have microorganisms everywhere. In general, when someone is referring to the microbiome, they are referring to the gut microbiome. And the gut microbiome itself is actually in the large intestine or the colon. A lot of times, I think people have this misconception that it's in the stomach, or they really don't know where the gut microbiome is. And we certainly have microorganisms throughout our gastrointestinal tract, in our mouth, in our throat, in our stomach, even in the small intestine and in the large intestine. But the greatest amount or the biggest collection of microbes in our body is in the colon. And that is what we refer to as the gut microbiome. There are three main characteristics of a healthy gut microbiome that I will cover in this presentation. And the first is diversity. Diversity is having a lot of different types of organisms. In adults, we want a high diversity because this will create a more resilient, adaptable, and productive environment. So we want as many different types of species as we can. This is an example of the Shannon diversity metric that is in the Tiny Health results. Second, we want balance. We want mostly beneficial microbes, but it's okay to have some variable and unfriendly. Now, a variable microbe is also known as an opportunistic. These are microbes that we can have in small amounts, and in small amounts, they may contribute to health. But when they are elevated, especially if there's a lot of different types of them that are elevated, or we see this in conjunction with not having enough beneficial or having too many unfriendly, then they seem to take on a role of more of a villain. So they become more unfriendly in those situations. So we want balance with the variables and the unfriendlies. It's important to note that it is okay to have some unfriendlies and it's okay to have variables. If we work too hard to eliminate all of these unfriendlies and variables, then it's going to eliminate the beneficials too. And that doesn't create a very resilient microbiome. And even in small amounts, these unfriendlies and variables, they do have health benefits for us. So the goal is not to get rid of all the reds or all the unfriendlies. This is an example of the microbiome breakdown on a tiny health test, and you can see at a glance how many beneficials, how many unfriendlies, variables, and unknowns we have. And I would consider this a very healthy microbiome, depending on exactly which species are here. So first characteristic is diversity, second is balance, and third is going to be productivity and functions. Who is in the microbiome matters, but more importantly, what are they doing there? That's more important than who is in the microbiome. So productivity and functions, microbes perform functions and produce byproducts that impact our overall health. Diversity and balance in microbes is going to result in balanced functions. Different microbes perform different functions. Your unfriendlies are going to produce more toxins and inflammation, and your friendlies are going to produce more short-chain fatty acids and vitamins, other important functions. So if we have diversity and we have balance in which microbes are present, then the functions that are being produced are going to be balanced as well. So functions are what the microbes do. Some microbes, like bifidobacteria, for example, produce anti inflammatory compounds like short chain fatty acids and vitamins. And then you have microbes that produce toxins and inflammatory compounds like LPS or lipopolysaccharide and hydrogen sulfide that contribute to damage in the gut and a lot of gastrointestinal symptoms like constipation and diarrhea, and can impact other parts of the body like the brain and the liver. So, who's there matters, but also what they are doing. And if we have a balance of who is in the microbiome, then their functions should be balanced too. Now let's talk about why we should use a microbiome test. How is it going to benefit us? The gut microbiome is a robust ecosystem of microorganisms that are intricately connected to the host health. The microbiome can either contribute to health or disease of the human host, depending on which microbes are in the microbiome and what functions they perform. This is an example of the gut organ axis. This is the way in which the gut communicates with other organs like the lung and the brain and the heart. And this is really a two-way street because these organs communicate with the gut as well. But for example, we have the gut brain axis, and the gut can actually communicate with the brain and contribute to either health or conditions like autism and psychiatric disorders. It's a big player in mood regulation, such as anxiety and depression. It can contribute to skin issues like psoriasis and eczema, as well as metabolic health. And we see the gut play a role in conditions like type 2 diabetes and obesity, as well as lung issues like asthma. So we talked about what a healthy microbiome is. Now let's talk about what a healthy gut is. And the first characteristic of a healthy gut is actually having a healthy microbiome. And again, remember that the microbiome is the collection of microbes who are in the ecosystem. And we want a nice, healthy balance with lots of abundant beneficials and low levels of pathogens or unfriendly microbes. The second characteristic is a healthy mucosal layer. That's this blue layer that we see in the picture. And the mucus helps to protect the intestinal barrier cells. That is these cells are what we see here in this drawing. It's one layer thick, and the mucus protects these cells from being overly exposed to antigens that are in the microbiome. So antigens are things that we don't necessarily want coming into contact with these cells and leaking into systemic circulation. They are things like toxins from our environment, toxins from the microbiome, certain unfriendly microbes, as well as food antigens. So the mucosal layer protects the intestinal barrier. It also protects the immune system. If we don't have a mucosal layer, then the immune system is going to be overly exposed to these antigens, and that's when we have a little bit of immune overreaction. So the mucosal layer is very important. And the microbes who are present in the microbiome contribute to this healthy mucosal layer. Third, we want healthy, tight junctions. This is the opposite of leaky gut. When you've heard about leaky gut, this is what it's referring to. And in this arrow, you can see it's almost like a gate with a lock on it. You've got these little locks, and that's the tight junctions. So if we have a healthy microbiome, healthy mucosal layer, then hopefully we're going to have healthy, tight junctions, which is the opposite of leaky gut, and that protects the too many of these antigens getting into systemic circulation or this blood flow below, because if they do, then they're free to circulate throughout our body to all of those organs that we saw in the gut organ axis picture before. Healthy microbiome means a healthy gut. Healthy gut means a healthy gut organ axis. What can go wrong? We looked at what a healthy microbiome in gut looks like, but what can go wrong in this process and how does it lead to an unhealthy gut? There's a number of what I call microbiome disrupting factors or dysbiosis risk factors that we're all exposed to. Not all of them, but we're exposed to a few of them every day, no matter how hard we try. So this is a pretty long list of things that can impact our microbiome, starting with prescription medications. Acid reducers and antibiotics are very prevalent and two of the biggest culprits, but most medications impact the gut microbiome in some way. Pesticides, and I want to think about your golfers Your hobby golfers, your professional golfers, they are exposed to an enormous amount of pesticides. And pesticides act as antimicrobials in the microbiome, killing off some of those beneficial bacteria. Also, pathogenic infections, excessive alcohol intake. Alcohol can act as an antimicrobial in the microbiome as well. Smoking, stress, and travel. Again, for your professional athletes, they may have a lot of travel in their schedule, and this, coupled with possibly poor diet from the travel and stress, can be very hard on the microbiome as well. Lack of sleep, intense exercise, or lack of exercise. And we're going to be talking a little bit more about this, but having no exercise is very bad on the microbiome. Intense exercise is actually just as bad on the microbiome. Lack of diversity in the diet. Different microbes consume different foods from our diet. So if we have a limited diet, then we're going to have limited diversity in the microbiome, and we need that healthy diversity in the microbiome to have a stable and resilient microbiome. Now, lack of diversity can occur for a number of reasons. A lot of us may have very limited diets for health purposes, food allergies and intolerances, or maybe we just put ourselves on what we consider a healthy limited diet, but it's not that great for the microbiome because it is limited. The standard American diet that's high in saturated fat, sugars, and low in fiber is very difficult on the microbiome, and heavy metal exposure from food and water. We might think of this as being something from the 70s or 80s. However, it's still very prevalent today. Even organic foods can have quite a bit of heavy metal in them. So we are exposed to heavy metals still today from food and water, and that impacts our microbiome. Another one is suboptimal digestion. Constipation and diarrhea. And athletes can experience a lot of IBS symptoms, constipation and diarrhea, and that will impact the microbiome. The microbiome certainly plays a role in constipation and diarrhea. But on the other hand, it is a two-way street, and constipation and diarrhea will impact the ecosystem in the microbiome, and it's a big microbiome disrupting factor. Oral dysbiosis is also a big microbiome disrupting factor in the gut. So we've been exposed to these microbiome disrupting factors. Now what happens to that healthy gut? First of all, we have dysbiosis, or an imbalance of those beneficial bacteria and too many of the unfriendly microbes in the gut. That leads to a degraded mucosal layer for several reasons. And you can see that here, that we don't have that nice thick blue layer anymore protecting these cells. Some of those unfriendly microbes actually eat away too much of this mucus. Sometimes it could be inflammation that degrades this mucosal layer, or even vitamin deficiencies. Then we have weak and inflamed tight junctions. Those fences and those locks aren't here anymore, and you can see these gaps between the cells, and you can see the antigens. You see bacteria and toxins, even food antigens, leaking through these cells, and then they get into the blood flow or the systemic circulation. They elicit an immune response, which means more inflammation travels to every organ in the body and can contribute to inflammation and health conditions there as well. So why test? Well, we've all been exposed to those microbiome disruptors that I listed. Some of us to a greater extent than others. For some of us, it's going to be more of an issue than for others. But at some point, we're all exposed. Even as hard as we try, we can't completely eliminate all of them. These microbiome disrupting factors impact the balance of microbes in the gut and lead to dysbiosis. Because different types of bacteria perform different functions, the postbiotics and functions being performed in the gut are also altered. So when we change who is there, we change what is being done there. We're going to have more of the harmful byproducts and functions being produced than the healthy ones, and that impacts our health. When I was going to dietetic school, we didn't really know much about this. We knew that if you took something like antibiotics, it was probably going to impact your beneficial bacteria. We didn't know how, and we didn't know what to do about it. So the general recommendation was to eat a lot of yogurt, or to take a kitchen sink probiotic. And by that, I mean a probiotic that has a lot of different random strains of probiotics in it at really high CFUs, and just hope that something sticks, and it's what we need. I call it the spaghetti on the wall method. But today we have really good tools to test the microbiome and get a glimpse inside that window to see what these microbiome disrupting factors actually did to the microbiome and what we can do as a result. So it gives specific insight into which probiotics, which dietary changes we can make to bring the microbiome back to balance. So, really, the only way to know how the microbiome has been impacted by these microbiome disruptors and therefore how to restore balance is with the microbiome stool test. Who should test? Well, in my opinion, everyone should test. We've all been exposed again to those microbiome disrupting factors, and the only way to know where a microbiome stands is through a test. So, anyone who has been exposed to microbiome disrupting factors, we want to know how these factors have impacted the microbiome, but more importantly, next steps to course correct and improve the microbiome. We can take it a step further, and perhaps it's your clients who know they've been exposed to these microbiome disrupting factors, but they're also having specific health symptoms and conditions, and they want to know how their gut and the microbiome is impacting the symptoms and conditions, and the next steps they can take to improve their microbiome in an effort to improve those overall health symptoms and conditions. For your athletes, it's going to be great for the athletes that have had GI symptoms like constipation, diarrhea, or have been exposed to prolonged intense exercise, or maybe even your golfers who have been exposed to a lot of pesticides, or your athletes who travel a lot. It could also be for your clients who are more interested in wellness and who are more proactive. Perhaps they have a pretty healthy lifestyle and diet. They don't really have any symptoms or health concerns, but they want to be proactive with their health and see what their microbiome looks like now to see if there's anything they can support to prevent any health conditions from exacerbating. A lot of times we can actually see in these people, we can see things happening in their microbiome before it shows up as a symptom or health condition. So even though they may seem pretty healthy and feel pretty healthy, there could be something going on in their microbiome. And if we course correct early enough, we can prevent those symptoms and health conditions from showing up. This is great for your exercisers and weekend warriors. How often should you test? This is really a rough guideline because it's going to depend on many different factors. For your exercisers and weekend warriors, it's great to test every 6 months if they're restoring the microbiome. So if they do a test and they see that there's something they need to work on, then generally we'll offer some recommendations and ask that they retest in about 4 to 6 months to make sure that we're on the right track and we've corrected what we need to correct. However, if they have a healthy microbiome, they feel like they're pretty healthy overall, perhaps it's something they do as part of their annual wellness and being proactive. So every 12 months. For your athletes who have a more consistent, rigorous training schedule and who have a little bit more stress, then I would recommend every 4 months if they're restoring the microbiome and managing GI symptoms. Every 6 months if they have a pretty healthy microbiome. This is because they're going to be exposed to those dysbiosis risk factors at a very high level with their stress and intense workout schedule. So we will need to test more often to be able to stay on top of it. Now, often when we think about doing a microbiome test, we're thinking about doing it for clients who have gastrointestinal symptoms. And this is definitely a great place to start for your patients or your clients who have bloating, abdominal pain, constipation, and diarrhea. However, remember that the gut plays a role in symptoms and health conditions outside of the gut through that gut organ axis. So it's great for your clients who don't have any GI symptoms, but perhaps they do have eczema or allergies, hormonal imbalance, anxiety and depression, autoimmunity, or conditions like non alcoholic fatty liver disease. The gut could be playing a role in all of those conditions, even without having gastrointestinal symptoms. So I really think that microbiome testing is something that everyone should do just as a baseline to see where you are and then go from there. Next, I want to talk about the athlete gut microbiome. And this is a really good review article that I'm going to spend a few slides on. But if you want to dig a little bit deeper and dive a little bit deeper into it, here is the information on how you can find that review article. So it appears that having a moderate amount of exercise is very, very beneficial for the microbiome. However, having a sedentary lifestyle or intense exercise may not be so great for the microbiome. And that is what this chart shows from this article. We see here in the first arrow, this is sedentary patients, and their microbiome is a little bit more inflamed. They also have a greater chance of experiencing upper respiratory tract infections, which is very prevalent in your elite athletes, gastrointestinal disorders, and inflammation. And then we have moderate amounts of exercise. And we see here that they have the least chance of having upper respiratory tract infections, gastrointestinal issues, and inflammation. And the intense and sustained exercise can have negative effects. And this is because blood is redistributed during strenuous exercise, causing a lack of blood flow to the gut. So it's shunted away from the gut to other muscles. This increases gut inflammation and permeability. Now, over time, this decreased blood flow to the gut contributes to longer lasting conditions such as gastritis and ulcers. Now, this is a two-way street. So the gut microbiome also contributes to exercise-induced GI issues. So exercise plays a big role in the health of the microbiome, but the health of the microbiome contributes significantly to the development of these GI issues. Strenuous exercise has an immunosuppressive effect at high intensity, which increases the risk of upper respiratory tract infections. You have probably experienced this with your pro and elite athletes. They just get run down a lot, the stress, the training schedule, and they are more prone to have upper respiratory tract infections, maybe catch viruses, and just be sick more often. There are specific probiotics that have protective effects against upper respiratory tract infections due to immunomodulatory properties that are stemming from the gut. Both upper respiratory tract infections and GI issues are related to levels of chronic systemic inflammation believed to be partly caused by increased gut permeability associated with intense exercise. So there's all different types of athletes. And again, you've got your exercisers, your weekend warriors, your elite professional athletes. And I used to own a gym with my husband, and we trained exercisers, weekend warriors, and professional athletes, anywhere from professional bull riders, MMA fighters, collegiate soccer players, triathlon athletes, Spartans, you name it. And I think there's a misconception out there that exercisers and athletes are healthy. And it's true that certain amount of exercise, that there is a population that we could consider pretty healthy. However, it encompasses such a wide variety of people. And on one end of the spectrum, we can have clients coming to us because they are unhealthy. Perhaps they're coming to us with diabetes, with autoimmune conditions, with other conditions, and they're coming to work out because they want to become more healthy. And those conditions will impact the microbiome, but they're also on medications to manage those conditions that impact the microbiome. You certainly do have those healthy clients who come to the gym on a regular basis. They eat healthy, they have pretty healthy microbiome, but I would say that they're not the majority of people that we find in the gym. You also have your type A clients who maybe overdo it a little bit, and they're more prone to developing eating disorders like anorexia and bulimia. They're more prone to never taking rest days. And anorexia and bulimia and never taking rest days are very difficult on the microbiome. And then you've got your elite athletes, your professional athletes, and they're typically dealing with injuries. So they have a lot of chronic pain. Perhaps they're taking a lot of ibuprofen, which can increase the risk of inflammatory bowel disease. They also deal with a lot of GI issues, and they deal with more IBS type symptoms, constipation, diarrhea, and the pain, the medications, their GI symptoms. Those are all difficult on the microbiome too. So I would say there's a wide variety of people when we think about exercisers and people who come to the gym that we're dealing with. So they're not that different from the normal population when we're thinking about their microbiome. And it's also important to consider that different types of sports tend to have a different type of microbiome depending on the type of exercise they're doing and their training schedule. Now, microbes utilize food from our diet to create byproducts that contribute to health or disease. We're going to talk a little bit more about functions here and why it is important to the athlete. So they use substrates derived from our food, carbs, fibers, protein, and fat to yield different byproducts like short chain fatty acids. And I've mentioned short chain fatty acids a few times, so I want to talk about what they are and why they're important for our health. Short chain fatty acids are produced mostly after beneficial bacteria ferment fibers. So we take in fibers from our diet, beneficial bacteria consume them and give off these short chain fatty acids. They're very important and they're a very hot topic right now because they're good for our overall health. They help to maintain a healthy gut lining, modulate the immune system, communicate with the brain, reduce inflammation, and even play a role in metabolic health, like improving insulin resistance. Now, they're not only an important energy source for our colonocytes, so they feed and fuel the cells in our colon so that we have a nice, healthy intestinal barrier, but it turns out they're also an important energy source for us. And they tend to be higher in athletes. So they're an important energy source for athletes. Athletes tend to have more of them, especially one of our favorite short chain fatty acids called butyrate. And they can help increase VO2 max or improve VO2 max. And a higher short chain fatty acids are also associated with increased carbohydrate uptake by skeletal muscle, lipid metabolism, and it improves fatty acid oxidation as well. So athletes want to make sure that they have plenty of butyrate producing bacteria and that they are feeding them well with foods that these butyrate producing bacteria like foods that are rich in inulin. You can think about leeks, onions, and asparagus. Now, the microbiome is not only important for helping us to metabolize fibers and carbs, but it also plays a role in protein metabolism. And the microbes in our large intestine, like Bacteroides, increase amino acid availability for the host, and they can also produce short chain fatty acids with positive impact on lean muscle mass. And this was done in an animal study. Mice treated with antibiotics gained less muscle mass following resistance training than untreated mice that undertook a corresponding level of exercise. So they had two groups. One mice group had antibiotics, one didn't. They both had the same training schedule. And those on the antibiotics had less lean muscle mass. So, and that was due to the low diversity. The antibiotics killed off the diversity, and those beneficial bacteria in the gut led to dysbiosis. Those microbes weren't there to help metabolize the proteins and produce branched chain amino acids, so it wasn't as available to the human host for building that lean muscle mass. Now, this is your cheat sheet. When we think about looking at a tiny health test, I want you to remember that exercisers and athletes' guts are going to vary greatly. So we can't just look for one pattern on a microbiome test. They're very similar to the non-athlete population with a few differences. And it's really going to depend on which disrupting factors these athletes have been exposed to and the type and intensity of the exercise that they do. But I want you to remember that all roads lead back to intestinal barrier permeability and inflammation. Whether you're an athlete or not an athlete, those gut disrupting factors will lead to intestinal barrier permeability and inflammation. That's what we're looking for in the microbiome, and that's what we want to correct. So this is how you look at it on a tiny health test. We've got elevated and low. So if anything in the elevated column is elevated, that's an increased risk factor for inflammation, which will lead to leaky gut. If anything on the test in the low column is low, that'll also increase your risk of intestinal barrier permeability and inflammation. In the elevated column, we're looking for disruptive microbes to be elevated, the antibiotic resistance signature, gut inflammation markers like LPS and mucus degradation, elevated protein breakdown capacity, histamine producing species, beta glucuronidase capacity, and GABA breakdown. On the low category, we're looking for the microbiome summary score to be low, beneficial microbes, short chain fatty acids, fiber and complex sugar digestion capacity, low vitamin production capacity, diversity, and GABA production. Now, keep this cheat sheet in mind. This is what you're going to look for when you look at the Tiny Health test. But it's not as important to have the information as it is to know what to do about it. So we want the information, but what do we do about it? That's what's important. Luckily, we have done all of this for you. We have science-driven recommendations on the Tiny Health test, all done for you in the action plan, and it's divided into 3 categories. You will see recommendations, first of all, for diet. We want to change how we feed the microbes, so we will have specific foods recommended in the action plan based off of what we find in the client's test. And we also offer recommendations for supplements, perhaps specific probiotics, depending on what we find in the microbiome. If we see specific bacteria or microbes there, then we will recommend specific probiotics to help to increase or decrease depending on what we see. We may also offer recommendations for prebiotics that feed the beneficial bacteria or serum-derived bovine immunoglobulins, which are really good for the immune system in athletes, especially for GI distress like diarrhea. And then third, lifestyle recommendations. And these are just a few examples, but recommendations for exercise, getting out into the outdoors more, using non-toxic cleaners to protect those good microbes in our microbiome, and stress reduction. So that is a quick overview of the microbiome and exercisers and athletes. Next, we're going to be meeting to take this information and use it to walk through an actual set of your client results. See you soon.